how are the needs of culturally diverse clients met within AoD treatment centres? So what can someone from a culturally and linguistically diverse background expect or be aware of prior to making any call for support?
Yes, thanks, Yom. And picking up on that last point about interpreters, we use them pretty widely across the AoD sector now. Certainly in our program, we use interpreters all the time, both face-to-face or over the telephone. So you can expect that the intake service or whoever you first contact can get an interpreter on the line fairly quickly in your first language. And if they can't locate that interpreter, then they will call you back with that interpreter. And as I said earlier, the ability for different alcohol and drug services to be culturally responsive varies across Victoria. And what we find is obviously where there is a big representation of a particular cultural community, you will have more cultural responsiveness, you know, from services in that area. So again, you know, earlier we were talking about detox and rehab places. Well, I've certainly, you know, referred clients to detoxes who have staff from South Sudanese background who speak Dinka or Nuer, and that's been a good match for my client. And in fact, within Turning Point in the Eastern region, we have quite a few staff from African background. Our manager, MP, is from South Africa himself. And so, you know, I think it's always great to see when we have a multicultural staff. But yeah, obviously some facilities are better set up, I guess, for certain cultural groups. I would sort of point out in the north and the west again that for our Muslim community, our Arabic communities and Muslim folks, you know, some of those detox or rehab centres are more across the need for halal food and, you know, particular gender requirements with staff that are working with residents and you know, making a prayer room available and practices for Muslim folks to meet the requirements of their faith. So yeah, there's some great services in the north and west who do that well. You know, I've had the experience of referring a Muslim woman to a detox service and particularly requesting halal food, and while it was all on the paperwork and they said yes we can do that, the week she was there was no halal food, you know, so she had the vegetarian options, but you know, that was very disappointing, and I followed it up with the service to say, you know, this is very important to my client, and you know, it's disappointing that it couldn't be provided. So we're always giving kind of feedback as well, and we welcome feedback from our clients too about each particular service, whether it be our service or services that we link them with. We want your feedback on how can we do it better. One of the ideas we had at Turning Point that we wanted to do last year was to have welcome events. And so have a welcome event where we'd have leaders and community members from, say, the 5 or 6 biggest cultural communities in our catchment come in and visit us at Turning Point. We're going to put on some food for you and meet and greet, and we're going to show you around our clinic. And we want your feedback on how can we make this more friendly, more welcoming for you and your community. Now, we didn't get to do that because of COVID, but it's still in the planning. And that's the sort of thing, working in a culturally responsive way, that's the sort of thing we try to do. All my clients that come in to see me at Richmond Clinic, I say, how do you feel, you know, in this waiting area? You know, what could we put up on the walls? How could we make this a bit more welcoming for you? And I think all services need to be doing that on a regular basis. you know, and also when we are community based, not having a facility look too much like a hospital ward, you know, because that's off-putting too for a lot of our culturally diverse folks, and the last place they want to go is hospital or anywhere that looks like a hospital, you know. So so these are the ways that we're learning and consulting with communities. But the other thing I just wanted to point out that people may not realise if they haven't been in contact with a lot of health services is that if a health service calls you, they will almost always have a blocked number. And that is for privacy reasons for you, so that no one from your family or your partner or whoever can look at your phone and say, oh, Turning Point called you today, what's that about, you know, kind of thing. So all health services do that, a lot of, you know, community welfare services as well. So, but sometimes people interpret that as there's a telemarketer calling me, or it might be the police, I'm not going to answer, you know. So just it's good to keep in mind. What we do with new clients is that we text them first. You know, we have work mobiles and we text and introduce ourselves via text, and then I'm going to be calling you at this time. Hopefully we can talk today, and that certainly helps a lot. And when you do that assessment process with your AoD worker, they will be asking you about your needs, say going into detox, for example. You know, what are your specific needs dietary wise, and do you need your own room? Is that very important to you? Not always possible, but certainly we can put in a request. Obviously people with mixed gender don't share rooms. Some facilities are female only as well for women who require that. And also, you know, requesting to work with either male or female workers, all of that is possible. The worker that's doing the assessment will be, you know, exploring all those issues with their client and trying to set up a situation that's as comfortable as possible for that client.